I am pleased to introduce Ms. Heather Higginbottom, Deputy Secretary of State for Management and Resources for the United States Government.
Your Excellencies, distinguished guests, ladies and gentlemen, I am pleased to be here today to underscore the commitment of the United States of America to fight AIDS, tuberculosis, and malaria worldwide. We're not only committed to fighting these three epidemics, we are committed to ending them by 2030. The Global Fund is central to this effort. We thank Prime Minister Trudeau for his personal leadership in hosting this year's conference to replenish the fund for the next 3 years and for Canada's significant pledge. I also want to thank my friend Mark Dybel for his boundless energy, tenacity, and dedication in leading the fund and his clear vision for its future. We all struggle to prioritize among the many issues vying for our attention and resources, but global health continues to stand out as a critical investment. 20 million lives have been saved since the Global Fund was established. AIDS-related deaths have dropped by 45% since their peak in 2004. Malaria deaths have dropped by 60% with expanded use of treated nets, and 15 million people have been tested and treated for tuberculosis since 2000. Given what we've accomplished in recent years, we could be tempted to turn our attention to other pressing issues, but that would be a mistake. By redoubling our efforts, we can achieve an AIDS-free generation. We can end the epidemics of malaria and tuberculosis. This is the time for greater action. As UNAIDS has shown, we have only 4 years to shift the trajectory of the HIV/AIDS epidemic. And if we don't seize this opportunity, we risk a total of 100 million HIV infections by 2030. That is why the United States is proud to be the largest contributor to the Global Fund, and it's why we've increased our pledge up to $4.3 billion through 2019. We will match $1 for every $2 in pledges made by other donors through September 30th of next year. Since 2004, the United States has committed more than $75 billion to fight these three diseases. We've strengthened our collaboration with the Global Fund Secretariat over the years so that we're now planning together, reducing duplication, and maximizing the impact of every dollar. And we've continued to push to achieve more with our funding, including when President Obama announced bold new HIV prevention and treatment targets for PEPFAR last year. The data tells us that these three epidemics still disproportionately affect the world's poorest and most vulnerable. Despite all of the progress we've made, HIV/AIDS remains the leading cause of death for women and girls of reproductive age in low and middle-income countries. Empowering this population is one of the smartest and most significant investments we can make to end HIV/AIDS. That's why in 2014, PEPFAR and several private sector partners launched the DREAMS Partnership to dramatically reduce new HIV infections and keep adolescent girls and young women determined, resilient, empowered, AIDS-free, mentored, and safe. We've come a long way, and we now have our sights set on what we can accomplish in the next 14 years. So let's meet the Global Fund's replenishment goal of $13 billion and work together to make these epidemics history. Thank you.
Thank you very much indeed.